Okay, welcome back, Pahrump. We're now in the last segment of this show. We're going to talk a little bit more about treatment. I'm your host, Dr. Michael Reiner, and again, thank you for tuning in to the Independent Doctors of Pahrump. We're talking about a very important subject, sleep apnea, and how much this affects almost your entire bodily function, and how important it is for you to be in tune with this one thing. And you know, if you do nothing else for yourself in the year, and you are overweight, and you are tired, and you are having difficulty sleeping, and you are taking pain medications and sleeping medications, please give yourself the protection of talking to your provider about having an overnight pulse ox test. And remember, when you do and you may need oxygen, remember that we do have a local provider for that oxygen right here on the corner of Calvada and Pahrump Valley Boulevard, the Pahrump Medical Supply. I encourage you to get your supplies and try and maintain the independence of all of our medical suppliers in this community, the doctors as well as the pharmacies, as well as those people who take the risk of bringing to you a service that you can have close to home. One of the issues I have when I put people on oxygen and I place them is the number one complaint is I make a call and I have to wait for somebody to come up from Las Vegas, and I kind of get a little tired of being the redheaded stepchild of Las Vegas. I would want to have my stuff here closer where I can get develop that relationship and get my supplies when I need. So if you happen to need that, please seek out the Pahrump Medical Supply. Okay, let's go back to the slide where we look at the person. These are the, if you remember in the previous segments, we saw how these patients actually stayed below the 90% or 88% level. We now have placed them on oxygen at 2 liters a minute, and we see that almost the entire time they're sleeping, and you can look in the bottom, and it looks like from 10 a.m. all the way to 4 a.m. on that bottom segment, they were almost above 90%. Maybe 99% of the time. And in the top slide, that particular person was above 90%, never fell below 88%. So this is a cure. I mean, this is basically a cure of overnight apnea, and just because they had what looked like obstructive sleep apnea, they didn't have to wear a CPAP. They didn't have to wear a mask that was obscuring their face or, you know, feeling like they had this positive pressure. For those that fail CPAP or fail regular oxygen, as we can see in the next slide, that this is a person that actually was on oxygen. If you look at the highlighted area, they actually had overnight 2 liters a minute. And this person showed absolutely no response from that oxygen. They still dropped dangerously low. This is where we now go into the next segment of treatment, where we have to use a positive pressure device, and that's what CPAP stands for, continuous positive airway pressure. And that basically is a situation where air is kind of forced into a jet situation to keep your airways open. It does take a lot to get used to. It does require a special apparatus. You know, you could be accused of being Darth Vader because you have this mask on your face that's blowing air. Patients describe it to me as a like we used to do when we were younger, stick our head out of a car going, you know, 30 or 40 miles an hour. If you ride a motorcycle and you don't protect your nose, it's probably the same situation. So those are situations where you have to wear the mask because you need that airway, and for those of really severe, they have to do different settings. Now, if you require this particular level of treatment, you will have to go into a sleep lab because they will have to titrate the pressures in order to see where this situation goes away. And sleep labs are much more intense, much more complex studies, and they do require you to be out of your home at night. Other things that we might look at to help, I guess we're looking at CPAP, continuous positive airway pressure. I talked about that. And then obviously, no, I'm not laughing at you. And this is a face of, and hopefully you'll be able to see the the surgical lines where they come in there, they actually remove some of the soft palate, they remove the uvula, which hangs down in this part of your throat, and they stitch it all back together. This is obviously a somewhat of a plastics or ear, nose, and throat procedure. So if you fail the CPAP, if you fail to use positive airway pressure, surgery may be an option, and you may have to go to varying lengths. I think that the person that requires surgery plus CPAP plus BiPAP, makes up less than 1/10 of 1% of the population. I'm amazed at how many people do very well with oxygen at night. The only consequence to using oxygen at night would be that if you have really bad COPD, you might have a situation where the oxygen concentrations actually depresses your respiratory rate, and that's usually in late stages of COPD when your body has been so used to low oxygen that you actually have what they call a carbon dioxide driver. Carbon dioxide in your body drives your breathing, and when you give someone in that stage of COPD oxygen, they actually stop breathing. I've seen it once or twice in my medical career. It's quite impressive when you think you're doing someone good by putting them on oxygen and they just don't want to breathe, which is totally not related to anything related to sleep apnea. So in summary, I hope that tonight's discussion has, one, alerted you to the seriousness of the problem. We as a society become sedentary. We have too much good food out there. We involve food in just about everything we do. Being obese, higher incidence of diabetes and all the other diseases that come from that. And one of those complex situations that, you can be on medication for your diabetes, you can be on medication for your cholesterol, and you may just have to be on supplemental oxygen to get you by until you feel better, to lose that weight, to get your blood pressure under control. If you're taking pain medications, if you're using sleeping pills, please protect yourself by getting an overnight pulse ox and see if you need the additional help of oxygen. One last thing we want to talk about, I'm going to hopefully start a section on this show, which is what they call the FAQ, or frequently asked questions, where if you're using Facebook to connect to local Pahrump and you have a question you want me to answer, something you wanted to ask a doctor, forgot to ask a doctor, please feel free to bring that to the attention of the Facebook, and we'll try and get that question answered. But this is summertime. One of the commonly misnomers, or one of the poorly understood issue, is sunscreen. Sunscreen is one of those things that people just apply on their body. They don't really know what it means. They don't know what it does. And I would just like to try and dispel a little bit of the rumor or a little mystery about the numbers. What they are talking about, if you put an SPF, and we have to assume that the SPF, whatever number you're using, never leaves your body during the sun exposure. One of the things is the key time to get your sun exposure is prior to 11 and certainly after 3 if you want to be safe. Earlier in the day, in the middle part of the day, the sun is very much stronger. It also goes up, the ultraviolet radiation goes up 5% per 1,000 feet. So we are at Pahrump, and we are basically at 2,300 feet altitude. The sun here is 10% stronger than it is at sea level. All the air and everything does tend to block some of the ultraviolet radiation. So with that being said, if you're getting your sun and you want to put SPF 15 on, what does that mean? Well, what it means is that if you have SPF 15 on the entire day, it never leaves your body, and you stay out in the sun 15 hours, you will get the equivalent of 1 hour of sun with no sunscreen. So it's a 15-to-1 ratio. The same as 30. And that's why anything over 15 is usually a waste of time and money. Why? I mean, nobody stays, the days aren't 30 hours long. I mean, you're not going to get sun for that period of time. However, if you're super sensitive, and let's suppose you were going to use 15 sunblock and you stayed out in the sun 2 hours, what would that be the equivalent of? Well, that would be the equivalent of 2 hours of no sun divided by 15. And that's a very small fraction of time. So you can use that to kind of guide where you want to be with sun exposure. If you're going to be out all day and you have not had any sun exposure, I would say use the SPF 15. Make sure it doesn't come off your body. Protect your face, protect your nose, protect your ears. Those are really sensitive tissues and they just need to be reapplied. So again, it's a ratio of time in the sun to what it would be if you had no sunscreen on. With that in mind, I hope to be able to bring one of the local dermatologists on so we can talk about skin and skin-related diseases. The independent dermatologist in this town would be a good discussion since we do live in an area where the sun shines a lot and people do see a lot of weathered skin. So we'll bring that up on a later topic. I hope you enjoyed tonight's show. Again, remember, think about your oxygen, think about the things you need to do, and we'll see you next Monday night on another edition of the Independent Doctors of Pahrump. Thank you very much for tuning in, Pahrump.